The question of whether or not there should be any reform is an extremely difficult and contentious question. The reaction of an awful lot of people, understandably, in particular the authorities, is that as soon as you start even discussing the question of some sort of loosening of the existing system or liberalization of drugs, that will give the impression to society as a whole that the authorities are losing their grip on the problem and that perhaps drugs aren't quite as bad as people have made out. But there are certain unpalatable facts that one must, I think, accept. First of all, of course, we don't appear to be winning the war against drugs. There seem to be just as many drugs in circulation now as there were, say, 20 years ago. Secondly, sadly, a very significant proportion of the population, particularly amongst the young, do consume controlled drugs, whether they be Class A or Class B. And thirdly, of course, and this is an international problem, the drugs trade, in effect, is netting the drugs barons a massive turnover running to billions and billions of pounds, which exceeds the gross national product of most countries. Overall, and above everything, we have got to recognize in the course of any debate that drugs are an appalling evil. And I think we've all been struck by stories, in particular, of young people with promising futures, able young people whose lives have been ruined and whose prospects have disappeared as a result of addiction to drugs. And that's why, of course, it is a very sensitive issue. But there is, in my view, a perfectly responsible body of opinion that believes that we've really run out of steam so far as the present system is concerned, and that we ought to consider a totally different approach. And one approach which is suggested, of course, is a system of licensing, whereby drugs are not prohibited, they are licensed. I'm certainly not advocating any immediate reform. I don't think there's a case for it. And one would have to be very careful. In my view, from what I've read, experiments in other countries, like Switzerland and Holland, where there have been at least temporary liberalization of laws, have not led to a very successful change in the situation. But I would, at some stage, like to see a serious debate on the issue initiated by Parliament. It should, of course, be a completely apolitical issue, and very serious consideration should be given by not only politicians but by pharmacologists and other experts as to whether or not there is a case for a reform along those or other lines. A difficulty is, of course, that it would be quite untenable for a particular country, say in Europe, to introduce a completely new regime of liberalization unless it was done in harness with our European partners, because you then get a tremendous influx of people coming into the country with the liberal laws. And we've seen something like that in the past in Holland. So that one has to be extremely cautious. But at the same time, I would like to see a serious debate, as I say, initiated by Parliament. And it may well be, at the end of the day, after very extensive debate, the decision will be reached that the present system, with its drawbacks, is nevertheless the best system that can be devised.